little toes are now visible. The size of the fetus at 9 weeks pregnant. At 9 weeks, the fetus is about the size of a cherry. Your little one may now measure 0.6 to 0.7 inch long and weigh about 0.12 ounce. Mom's body at 9 weeks pregnant. Symptoms at 9 weeks pregnant may include changes to your breasts. They are probably fuller, heavier, and tender to the touch due to the enlargement of your milk glands and an increase in fatty tissue. Although your breasts will likely continue to grow throughout your pregnancy, the sensitivity will usually subside once your body adjusts to the surge of pregnancy hormones. 9 weeks pregnant, your symptoms. At 9 weeks pregnant, here are some of the symptoms you may be experiencing. Growing waistline. Your belly at 9 weeks pregnant may not have a pronounced, rounded look, but your pre-pregnancy clothes are probably feeling a little snug due to a combination of a thickening waistline and some bloating brought on by your old friends, pregnancy hormones. Spotting. You may see some spotting in the first trimester. Call your healthcare provider if you see any more than a few drops of blood. Mild uterine cramping. This is a time of rapid change in your body, and you may experience mild uterine cramping. If the cramping is severe, or if you feel other pain like lower back pain, call your doctor to rule out any problems. Morning sickness. If you haven't experienced morning sickness by now, you could be one of the lucky ones who will avoid this common symptom. But if you do get morning sickness, keep on eating smaller meals frequently throughout the day and remember to stay hydrated. Being hungrier. You may start to feel a bit hungrier than usual, so munch on some extra snacks, keeping in mind that you only need to add about 300 calories to your daily intake. Foods like fruit, cereal, and yogurt are great choices. Food cravings and aversions. Your sense of smell is heightened now, and foods and smells you once enjoyed may now seem unpleasant. On the flip side, you may now find you crave certain foods. You can feel free to indulge any food cravings you have, as long as they seem healthy. Just make sure you're sticking to a balanced diet. Always talk to your healthcare provider if you crave non-food things like dirt or chalk. Fatigue. Thanks to an increase in your levels of the hormone progesterone during the first trimester, you may find yourself sleepier than usual. Rest as much as you can during the day, particularly if you're having trouble sleeping at night. Feeling moody. If you're feeling on top of the world 1 minute and doomed the next, you can thank pregnancy hormonal changes. Speak to loved ones about how you're feeling. It may help you feel a little better, and seek help from your healthcare provider if your mood swings are severe. Frequent urination. Yes, those extra trips to the bathroom may still be a part of your day as your baby grows and your uterus presses against your bladder. This need to pee more often may also be caused by the increased volume of blood in your body, which makes your kidneys work overtime. Don't drink less water, as staying hydrated is important, but try to go to the restroom before you head out the door or before you go into a long meeting. If you notice a burning sensation or pain when you pass urine, call your doctor, because this can be a sign of a urinary tract infection. Acne. If you're experiencing acne now and didn't before you got pregnant, or if your acne is worse now than before, it may be one of your pregnancy symptoms. Read up on how you can combat some of those spots and blemishes, and remember that it's just one of those pesky pregnancy hormone-related symptoms that should clear soon after your baby is born.
Hey there, lovely viewers. We're thrilled to have you back on our channel. Today, we're diving deep into a topic that's close to many hearts: how to boost your chances of getting pregnant. Whether you're just starting your journey or have been trying for a while, these detailed tips could be the key you're looking for. Point 1. Understand your menstrual cycle. Your menstrual cycle consists of different phases: follicular, ovulation, and luteal. Ovulation usually occurs around the middle of your cycle. Keep track of it using methods like basal body temperature or ovulation predictor kits. The fertile window spans a few days before and after ovulation, so aim for intimacy during this time. Point 2. Maintain a healthy lifestyle. Nutrition plays a pivotal role in fertility. Incorporate a variety of fruits, vegetables, whole grains, lean proteins, and healthy fats into your diet. Regular, moderate exercise can help regulate your hormones and boost overall well-being. Stress can interfere with ovulation. Practice stress reduction techniques like meditation, mindfulness, or even enjoyable hobbies. Point 3. Maintain a healthy weight. Being underweight can disrupt hormonal balance, while excess weight can lead to insulin resistance and irregular cycles. Aim for a BMI within the healthy range for optimal fertility. Point 4. Avoid harmful substances. Smoking can decrease fertility in both men and women. Quitting is a major step towards improving your chances. Limit alcohol consumption, as excessive intake may affect hormone levels. High caffeine intake has been linked to reduced fertility, so consider cutting back. Point 5. Preconception health check. Before embarking on your pregnancy journey, schedule a thorough health checkup with your doctor. Discuss any pre-existing conditions, medications, or supplements you're taking that could impact fertility. Point 6. Stay hydrated. Drinking enough water helps maintain healthy cervical mucus, which plays a role in fertility. Point 7. Timing matters. It's important to remember that pregnancy might not happen right away. Continue trying during your fertile window, but don't stress if it takes some time. Point 8. Communication is key. Openly communicate with your partner about your feelings, concerns, and expectations. Keep the lines of dialogue open throughout the journey. Point 9. Seek professional help if needed. If you're having trouble conceiving, don't hesitate to consult a fertility specialist. They can perform tests to identify any underlying issues and recommend appropriate treatments. Conclusion. Thank you so much for joining us today as we explored these comprehensive tips for increasing your chances of getting pregnant. Remember, each person's fertility journey is unique, so be patient and kind to yourselves. If you found this video helpful, don't forget to give it a thumbs up, share it with others, and hit that subscribe button for more insightful content. Introduction, greetings and welcome. Mention the importance of a healthy diet during pregnancy. Point 1. Balanced diet. Emphasize the need for a well-balanced diet. Include a variety of food groups, fruits, vegetables, whole grains, proteins, and dairy. Highlight the importance of getting essential nutrients from different sources. Point 2. Folic acid and iron. Discuss the significance of folic acid in preventing birth defects. Mention good sources of folic acid, leafy greens, citrus fruits. Fortified cereals. Highlight the importance of iron for preventing anemia during pregnancy. Include iron-rich foods, lean meats, beans, spinach, and fortified cereals. Point 3. Omega-3 fatty acids. Explain the benefits of omega-3 fatty acids for the baby's brain development. Include sources of omega-3s. Fatty fish like salmon, chia seeds, flax seeds, walnuts. Point 4. Adequate hydration. Stress the importance of staying hydrated during pregnancy. Recommend water as the primary beverage. Limit caffeine intake and avoid sugary drinks. Point 5. Calcium for bone health. Discuss the need for calcium in supporting the baby's bone development. Include good sources of calcium, dairy products, fortified plant-based milk, leafy greens. Point 6. Small, frequent meals. Suggest eating smaller, more frequent meals to ease digestion. Emphasize the importance of snacks with a balance of nutrients. Point 7. Foods to avoid. List foods that should be avoided during pregnancy. Raw fish, unpasteurized dairy, excessive caffeine, etc. Explain the reasons behind these restrictions for the baby's safety. Conclusion. Recap the key points. Encourage consulting with a healthcare provider for personalized advice. Invite viewers.
Fast track to fertility. Expert tips from a leading doctor. 1. Introduction. Welcome viewers. Today we're sharing the top 20 tips to boost fertility and increase your chances of getting pregnant fast. 2. Healthy lifestyle. Maintain a healthy lifestyle with a balanced diet and regular exercise to support overall well-being. 3. Nutrient-rich foods. Focus on nutrient-rich foods, including fruits, vegetables, whole grains, and lean proteins to enhance fertility. 4. Hydration. Stay well hydrated by drinking plenty of water, promoting optimal reproductive health. 5. Limit caffeine and alcohol. Reduce caffeine and alcohol intake, as excessive consumption can impact fertility. 6. Maintain a healthy weight. Achieve and maintain a healthy weight, as both underweight and overweight conditions can affect fertility. 7. Regular exercise. Engage in regular moderate exercise, which can positively influence reproductive health. 8. Balanced hormones. Ensure hormonal balance through a healthy lifestyle and, if needed, consult with a doctor for guidance. 9. Quit smoking. Quit smoking as it has detrimental effects on fertility and reproductive organs. 10. Stress management. Practice stress management techniques such as meditation, yoga, or deep breathing to reduce stress levels. 11. Regular checkups. Schedule regular checkups with a fertility specialist to monitor reproductive health. 12. Know your cycle. Understand your menstrual cycle to identify your most fertile days and optimize conception timing. 13. Tracking ovulation. Use ovulation prediction kits or apps to track ovulation accurately for better timing. 14. Position matters. Experiment with different sexual positions to increase the chances of sperm reaching the egg. 15. Optimal timing. Be consistent with intercourse during the fertile window to maximize the chance of conception. 16. Sperm health. Encourage sperm health by avoiding hot tubs, tight underwear, and excessive heat exposure. 17. Preconception supplements. Consider taking preconception supplements like folic acid to support a healthy pregnancy. 18. Limit exposure to harmful substances. Minimize exposure to environmental toxins and chemicals that may affect fertility. 19. Fertility-friendly lubricants. Use fertility-friendly lubricants that do not hinder sperm movement. 20. Patience and emotional support. Be patient and seek emotional support during the fertility journey, understanding that it may take time. Conclusion: thank you for watching. Implementing these tips can significantly boost your chances of getting pregnant fast. Remember, consulting with a fertility specialist is crucial for personalized advice.
10 weeks pregnant. Your baby's development. Your baby has come a long way in just a few short weeks. That little head is taking on a rounder, more human shape, and by now all the internal organs should be in place and starting to work together. Tiny tooth buds have begun to develop too. Your baby's fingers and toes are growing longer, and the webs that had been between each finger and toe are starting to disappear. At the moment, your baby's eyes, eyelids, and ears are continuing to develop, but they've still got some growing to do before they're fully formed. The size of the fetus at 10 weeks pregnant. Your little one is still growing very quickly. At 10 weeks, the average fetus is about the size of a strawberry, measuring approximately an inch from crown to rump. Mom's body at 10 weeks pregnant. Your uterus is about the size of a large orange at this point, whereas before you became pregnant, it was about the size of a small pear. Around this time, you likely have had or will soon have a visit with your healthcare provider for a thorough examination. At this appointment, your provider may do an internal and external abdominal exam to determine the size and position of your baby, as well as take blood samples for a variety of other tests. These blood tests may be used to determine if you have any infections, what your blood type and Rh factor are, and whether your own immunizations are up to date. 10 weeks pregnant, your symptoms. At 10 weeks pregnant, here are some of the symptoms you may be experiencing. Morning sickness. You're not alone if you're 10 weeks pregnant and you're still suffering from morning sickness. The good news? You're likely to start feeling better soon. Morning sickness often goes away after you enter the second trimester. Keep in mind, some moms-to-be experience a more severe form of morning sickness called hyperemesis gravidarum. If you suspect you may have this, speak to your healthcare provider. Round ligament pain. Of all of the pregnancy symptoms you may be experiencing around this time, this one is among the most uncomfortable. Round ligaments are two of the ligaments in your pelvis that help support the uterus, and as your baby grows during pregnancy they stretch and soften. When these ligaments tighten, you may feel pain on one or both sides of your abdomen. Changing positions in bed or doing strenuous exercise may bring on this pain. Light stretching and gentle movements may help relieve the discomfort. If this symptom doesn't go away on its own, or if you also have a fever, call your healthcare provider. Minimal weight gain. Even though your clothes may be fitting a bit tighter, you may not have gained much weight, and you may even have lost a little if you've been dealing with morning sickness. Be sure to talk to your doctor if you're concerned. Exhaustion. You might feel like napping at every opportunity. This could be thanks to the increased levels of the hormone progesterone in your body. Headaches. Some moms-to-be get the occasional headache during pregnancy. If you're experiencing this symptom, try to rest in a darkened room and apply an ice pack to your head or neck to help relieve the pain. Contact your healthcare provider if the headache persists or is severe. Mood swings. Hormonal changes may play a role in the highs and lows you feel when you're about 10 weeks pregnant. You may find it helpful to distract yourself by chatting with friends, watching funny TV shows or movies, or treating yourself to a massage. Just be sure to choose a trained masseuse who knows about safe massage techniques for pregnant women. Vaginal discharge. You might be seeing more vaginal discharge than before, which is caused by your increased blood supply and higher hormone levels. This normal vaginal discharge is known as leukorrhea, and you can expect to see a clear to milky colored, nearly odorless discharge that may appear slightly yellowish on your underwear. Contact your healthcare provider, though, if you notice a strong odor or color changes, or if you experience itching or bleeding around the vaginal area. Acne. If you're experiencing acne now and didn't before you got pregnant, or if your acne is worse now than before, it may be one of your pregnancy symptoms. And remember that it's just one of those pesky pregnancy hormone-related symptoms that should clear soon after your baby is born.
Hello, expecting moms. Congratulations on reaching the third trimester of your pregnancy. As your due date approaches, it's important to stay active and maintain a healthy lifestyle. Today, we have compiled a set of safe and effective pregnancy exercises that will help you stay fit, reduce discomfort, and prepare your body for labor. Remember to consult with your healthcare provider before starting any new exercise routine. Let us get started. Point 1. Warm up. Begin with a gentle warm-up to increase blood flow and flexibility. March in place for 2 minutes to warm up your legs and get your heart rate up. Perform shoulder rolls and gentle arm circles to loosen up your upper body. Point 2. Pelvic tilts. Pelvic tilts help relieve lower back pain and strengthen your core. Stand or get on your hands and knees. Gently tilt your pelvis forward and backward, arching and rounding your back. Repeat for 10-15 reps, holding each position for a few seconds. Point 3. Squats. Squats are excellent for preparing your pelvic floor and thighs for labor. Stand with your feet shoulder width apart, toes pointing slightly outward. Slowly squat down as if you're sitting in a chair, keeping your back straight. Exhale as you come up and squeeze your glutes at the top. Aim for 3 sets of 10-12 squats. Point 4. Modified push-ups. Modified push-ups help strengthen your arms, chest, and core without straining your belly. Position yourself on your hands and knees. Lower your chest tower chest. Point 5. Kegel exercises. Kegels strengthen the pelvic floor muscles, which can ease delivery and postpartum recovery. Sit or lie down comfortably. Squeeze your pelvic muscles as if you're trying to stop the flow of urine. Hold for 5-10 seconds and release. Aim for 3 sets of 10-15 repetitions. Point 6. Side-lying leg lifts. Side-lying leg lifts target the hips and outer thighs. Lie on your side with your head supported by your arm. Lift your top leg slowly, keeping it straight, and then lower it back down. Perform 12-15 reps on each side for 2 sets. Point 7. Cat-cow stretch. The cat-cow stretch helps improve flexibility and reduce back pain. Get on your hands and knees, aligning your wrists under your shoulders and knees under your hips. Arch your back while inhaling, bringing your head up cow position. Round your back while exhaling and tuck your chin towards your chest cat position. Repeat for 10-12 breath cycles. Conclusion. Congratulations, you've completed a safe and effective pregnancy workout for the third trimester. Remember to listen to your body and avoid any exercises that cause discomfort or pain. Staying active during pregnancy can lead to a smoother labor and quicker postpartum recovery. Don't forget to hydrate and get plenty of rest. If you enjoyed this workout, consider subscribing.
C-Section Recovery Guide, 20 Essential Tips for New Moms. 1. Introduction. Start by welcoming viewers and acknowledging the commonality of C-sections in childbirth. 2. Immediate post-op care. Discuss the importance of following medical advice for wound care and pain management. Highlight the significance of rest and limited physical activity in the initial days. 3. Incision care. Explain how to clean and care for the incision site. Stress the significance of keeping the incision dry and watching for signs of infection. 4. Pain management. Talk about prescribed pain medications and their proper usage. Suggest non-pharmacological methods like using a heating pad or practicing deep breathing exercises. 5. Activity guidelines. Emphasize the need for gradual reintroduction of daily activities. Recommend avoiding heavy lifting and strenuous exercise until approved by a healthcare professional. 6. Nutrition and hydration. Highlight the importance of maintaining a healthy diet for recovery. Encourage staying hydrated to aid in healing. 7. Monitoring postpartum bleeding. Discuss what is considered normal postpartum bleeding and when to seek medical attention. 8. Emotional well-being. Address the emotional aspects of recovery and potential postpartum emotions. Encourage open communication with healthcare providers about mental health concerns. 9. Follow-up appointments. Stress the importance of attending postoperative checkups. Explain what to expect during these appointments and how healthcare providers monitor recovery. 10. Support system. Discuss the role of family and friends in providing support. Emphasize the importance of seeking help when needed. 11. Breastfeeding after C-section. Offer guidance on breastfeeding positions that are comfortable post-surgery. Highlight the benefits of breastfeeding for both the mother and baby. 12. Scar massage. Introduce scar massage as a technique to promote healing and reduce scar tissue. Demonstrate gentle massage techniques. 13. Resuming intimacy. Discuss the importance of waiting until physically and emotionally ready. Provide tips for comfortable intimacy post-C-section. 14. Postpartum exercise guidelines. Explain when it's safe to start postpartum exercises. Offer examples of gentle exercises to aid in recovery. 15. Birth control options. Discuss contraceptive options suitable for post-C-section recovery. Encourage discussions with healthcare providers about family planning. 16. Warning signs. Outline potential complications and the importance of recognizing warning signs. Stress the need to seek immediate medical attention for any concerning symptoms. 17. Scar appearance. Address common concerns about the appearance of the scar. Provide reassurance that scars tend to fade over time. 18. Returning to work. Discuss factors to consider when planning a return to work. Emphasize the importance of balancing work responsibilities with ongoing recovery needs. 19. Long-term care considerations. Mention the potential for future pregnancies and how that may impact the C-section scar. Discuss any long-term considerations or precautions advised by healthcare professionals. 20. Conclusion. Summarize key points. Encourage viewers to consult with their healthcare providers for personalized advice. Remember to tailor the script to your audience and provide a disclaimer to consult with healthcare professionals for personalized advice.
IUI stands for intrauterine insemination, which is a fertility treatment used to increase the chances of pregnancy. The procedure involves placing sperm directly into a woman's uterus to facilitate fertilization. IUI is commonly used to treat infertility due to low sperm count, decreased sperm motility, or issues with cervical mucus. Prior to the procedure, the woman may receive ovulation-inducing medication to increase the likelihood of successful fertilization. IUI is a relatively simple and non-invasive procedure that can be performed in a doctor's office. It is usually painless and does not require anesthesia. The success rate of IUI varies depending on several factors, including age, fertility issues, and the number of insemination cycles performed. The risks of IUI are minimal, but there is a small risk of infection or discomfort. IUI is often combined with other fertility treatments, such as in vitro fertilization, IVF, to improve the chances of pregnancy. Overall, IUI can be an effective treatment option for couples struggling with infertility, but it is important to discuss all available options with a fertility specialist to determine the best course of action.
Oh hey everyone, welcome back to. Today we have a topic that's close to the hearts of many expecting mothers out there. Maintaining fitness while pregnant. Whether you're a mom-to-be or just curious, this video is packed with tips to keep you active and healthy throughout your pregnancy journey, so let's dive in. Segment 1. The importance of staying active. Pregnancy is not a reason to hit pause on your fitness journey. In fact, staying active during this special time can bring a world of benefits, from boosting your mood to improving your posture and sleep. The advantages are endless, but of course safety is key, so let's talk about the types of exercises that are perfect for moms-to-be. Segment 2. Safe and effective exercises. Now, when it comes to exercising during pregnancy, it's crucial to choose activities that are gentle on your changing body. Opt for low-impact exercises like walking, swimming, and prenatal yoga. These not only keep your heart pumping but also help in maintaining muscle tone and flexibility. Remember, always consult with your healthcare provider before starting any new workout routine. Segment 3. Tailoring your workouts. One size doesn't fit all, especially when it comes to pregnancy workouts. Tailoring your exercises to your individual needs is key. If you were active before pregnancy, you might be able to continue with modifications, but if you're new to exercise, start slow and gradually increase intensity. Our bodies are incredible, and adapting our workouts ensures a healthy journey for both mom and baby. Segment 4. Listen to your body. Pregnancy comes with its own set of physical changes, and it's essential to listen to your body. If something doesn't feel right, modify or skip it. This isn't the time to push your limits. Pay attention to your energy levels and give yourself the rest you need. Remember, a happy and healthy mom means a happy and healthy baby. Segment 5. Building a support system. Host. Staying fit during pregnancy is not just about the physical aspect. Point 4s. Greater than. It's also about having a strong support system. Connect with other expecting moms, join prenatal fitness classes, or even involve your partner in your workouts. Having a community around you can make this journey even more enjoyable. Conclusion. And there you have it, tips and tricks to stay fit and active during pregnancy. Remember, every pregnancy is unique, so consult with your healthcare provider to create a personalized fitness plan. If you enjoyed this video, give it a thumbs up, and don't forget to subscribe for more content. Take care.
8 weeks pregnant, your baby's development. This week, hands and feet are forming tiny fingers and toes, and those arms are able to flex at the elbows and wrists. At this point, eyes begin to develop pigment, and genitals are forming too, although it's still too soon to know whether you're expecting a boy or a girl. If you feel like taking a guess though, have some fun with our baby gender quiz. These external features aren't the only things developing. The internal organs are making strides. As the intestines form, they start to take up space in the umbilical cord because there's not enough room in your baby's abdomen yet. Even at this early stage, the intestines are working to carry waste away from the body. A month from now, when there's more room in your little one's belly, the intestines will move out of the cord and back into the abdomen. The size of the embryo at 8 weeks pregnant. Your baby has already come a long way, and soon, growth will speed right up. Your little one is about the size of a raspberry this week, just 0.5 to 0.6 inch long, crown to rump. Mom's body at 8 weeks pregnant. By the time you're 8 weeks pregnant, pregnancy symptoms will be in full swing. Your clothes may start to pinch a little, but on the plus side, you may be able to hear your baby's heartbeat for the first time, something to make up for the not-so-pleasant symptoms you may have been experiencing. You may be wondering when you will start showing. 8 weeks pregnant, your symptoms. At 8 weeks pregnant, here are some of the symptoms you may be experiencing. Morning sickness. You may be dealing with nausea and even vomiting right about now. The good news is morning sickness symptoms usually subside during the second trimester, and you're almost there. For now, try nibbling on crackers before you get up, and aim for 5 or 6 small meals a day, rather than 3 large ones. Food and smell aversions. Certain tastes and odors that have never bothered you before may seem overbearing or repugnant, thanks to increased hormones that amplify your sense of smell and make your stomach feel as if you're on a wild roller coaster ride. Diarrhea. Your digestive system may be far more sensitive now. Make sure you're practicing healthy eating habits and staying hydrated. Contact your healthcare provider if the diarrhea lasts longer than 24 hours or is accompanied by any other symptoms, and do not take anti-diarrheal medicine or any medication before checking with your provider. Frequent urination. Yes, you may still be making lots of extra trips to the bathroom. This symptom will come and go throughout the rest of your pregnancy as your baby grows and your uterus expands, both of which put pressure on your bladder. Abdominal cramping. This symptom can be associated with the continued growth of your uterus. Back pain. By the time you are 8 weeks pregnant, back pain may strike, particularly around the lower back. That's because the muscles in your back are working a bit harder than usual as your weight is redistributed to accommodate your growing uterus. Furthermore, your center of gravity is changing, and those pregnancy hormones are working on relaxing ligaments in the joints of your pelvis. Light spotting. Spotting, a few drops of blood at a time, can be normal. However, be sure to talk to your healthcare provider if you feel at all concerned and call right away if you notice heavier bleeding. Fatigue. Your progesterone levels are increasing, which can often leave you feeling more tired than usual. Go ahead and grab some extra snooze time whenever you can. If you're feeling exhausted, listen to your body and try to take it easy. Trouble sleeping. Changing hormone levels, discomfort, and extra trips to the restroom often add up to disturbed sleep. Try listening to peaceful music or reading a book if you're feeling wide awake. You can also try drinking warm milk or taking a shower or bath before bed. Some women find lying on their left side is helpful as it improves blood circulation. Placing a pillow between your knees may help you feel more comfortable too.
Title: Effective PCOS Treatment, 20 Key Steps to Manage Polycystic Ovary Syndrome. 1. Introduction. Greet your viewers and provide a brief overview of PCOS. Mention the importance of early diagnosis and management. 2. Understanding PCOS. Explain what PCOS is and its impact on women's health. Highlight common symptoms such as irregular periods, acne, and weight gain. 3. Seek professional help. Emphasize the importance of consulting a healthcare professional for a proper diagnosis. Encourage viewers to find a healthcare provider experienced in managing PCOS. 4. Lifestyle modifications. Discuss the role of diet and exercise in managing PCOS symptoms. Suggest a balanced diet with emphasis on whole foods and regular physical activity. 5. Weight management. Address the link between PCOS and weight gain. Provide tips on healthy weight loss strategies, if applicable. 6. Medication options. Briefly explain common medications prescribed for PCOS, such as birth control pills and anti-androgens. Highlight the importance of medication adherence. 7. Nutritional supplements. Discuss supplements like inositol and vitamin D that may benefit women with PCOS. Emphasize consulting a healthcare professional before starting any supplement regimen. 8. Fertility considerations. Touch on the challenges PCOS may pose to fertility. Mention fertility treatments and options for those planning to conceive. 9. Hormonal balance. Explain how hormonal imbalances play a role in PCOS. Discuss hormone therapy options prescribed by healthcare professionals. 10. Regular monitoring. Stress the need for regular checkups and monitoring of PCOS symptoms. Encourage open communication with healthcare providers. 11. Stress management. Discuss the impact of stress on PCOS symptoms. Suggest stress reduction techniques such as meditation and yoga. 12. Sleep hygiene. Highlight the importance of adequate sleep for overall health. Discuss the link between PCOS and sleep disturbances. 13. Skincare. Address skin-related concerns associated with PCOS. Provide skincare tips to manage acne and other skin issues. 14. Customized treatment plans. Acknowledge that PCOS treatment is not one size fits all. Encourage viewers to work with their healthcare providers to develop personalized plans. 15. Educational resources. Recommend reliable sources for further PCOS education. Mention reputable websites and support groups. 16. Community support. Emphasize the value of connecting with others who have PCOS. Mention online forums or local support groups. 17. Ongoing education. Encourage viewers to stay informed about new developments in PCOS research. Highlight the importance of staying proactive in managing one's health. 18. Mind-body connection. Discuss the impact of mental health on PCOS. Encourage practices that promote a healthy mind-body connection. 19. Long-term outlook. Discuss the long-term management of PCOS. Address the potential impact on overall health as women age. 20. Conclusion. Summarize key points. Encourage viewers to take a proactive approach to their PCOS management. Remember to tailor the script to your audience and provide accurate, up-to-date information. Conceiving with PCOS, 20 tips for a successful pregnancy journey. 1. Introduction. Welcome to our channel. Today, we're discussing a topic that many women with polycystic ovary syndrome, PCOS, face: how to increase the chances of getting pregnant despite PCOS. 2. Understand PCOS. Briefly explain what PCOS is and its impact on fertility. 3. Consult a specialist. Point out the importance of seeking advice from a fertility specialist or gynecologist. 4. Lifestyle changes. Discuss the significance of adopting a healthy lifestyle, including a balanced diet and regular exercise. 5. Maintain a healthy weight. Highlight the connection between weight management and PCOS-related fertility issues. 6. Monitor ovulation. Explain methods for tracking ovulation, such as using ovulation predictor kits. 7. Timing intercourse. Offer guidance on the optimal timing for intercourse during the menstrual cycle. 8. Fertility-friendly diet. Suggest foods that may positively impact fertility for women with PCOS. 9. Stay hydrated. Emphasize the importance of staying hydrated for overall reproductive health. 10. Reduce stress. Discuss stress management techniques as stress can impact fertility. 11. Supplements. Introduce supplements like folic acid and inositol that may support fertility. 12. Medications. Briefly mention medications that may be prescribed to regulate ovulation. 13. In vitro fertilization, IVF. Touch on the option of assisted reproductive technologies like IVF. 14. Acupuncture. Mention studies suggesting acupuncture may aid fertility in women with PCOS. 15. Regular checkups. Encourage regular checkups to monitor progress and adjust strategies if needed. 16. Partners' health. Remind that male fertility is crucial and partners should maintain their health. 17. Educate yourself. Encourage women with PCOS to educate themselves on their condition and fertility. 18. Community support. Recommend joining online communities or support groups for sharing experiences. 19. Patience and persistence. Emphasize that the journey might take time and persistence is key. 20. Closing. Conclude with a message of hope, reminding viewers that many women with PCOS.
Welcome back to our channel. Today, we're diving into the topic of normal delivery and discussing whether it's the right choice for expecting mothers. Giving birth is a transformative experience, and there are various methods available. Let us explore the pros and cons of opting for a normal delivery. Point 1. Natural process. Host. Normal delivery, also known as vaginal birth, is a natural process that has been practiced for centuries. Many argue that it is the way our bodies are designed to bring new life into the world. Pro. Natural process. Normal delivery allows the mother to experience the natural progression of labor, which can enhance the bond between mother and child. It also allows the mother's body to release hormones, such as oxytocin, which aid in breastfeeding and postpartum. Recovery. Con. Pain and discomfort. While normal delivery is a natural process, it can involve intense pain and discomfort during labor. This can be challenging for some women, and pain management techniques like breathing exercises and epidurals may be necessary. Point 2. Faster recovery. Host. Another aspect to consider is the recovery period after childbirth. Let us take a closer look at the pros and cons related to recovery. Pro. Faster recovery. Compared to a cesarean section, normal delivery typically results in a shorter hospital stay and faster postpartum recovery. Women who have a normal delivery may find it easier to resume their daily activities and care for their newborn. Con. Physical trauma. Despite the faster recovery, normal delivery can cause physical trauma, such as perineal tears. Recovery from these tears can take time and require additional care and attention. Point 3. Lower risk of complications. Host. Ensuring the safety of both the mother and baby during childbirth is a top priority. Let us discuss the pros and cons associated with the risk of complications. Pro. Lower risk of complications. In many cases, normal delivery is considered a safer option compared to cesarean sections. It carries a lower risk of infection, blood loss, and complications related to anesthesia. It also promotes natural immune system development for the newborn. Con. Unpredictability. Normal delivery is not without risks. Complications such as umbilical cord prolapse or shoulder dystocia can occur during labor. These situations require immediate medical intervention to ensure the well-being of both mother and baby. Point 4. Support and guidance. Host. Having a strong support system and access to guidance is crucial during childbirth. Let us explore the pros and cons related to support and guidance during normal delivery. Pro. Emotional support. Many women find comfort and reassurance in having their loved ones present during labor. The support of a partner, family members, or a doula can help alleviate anxiety and provide encouragement. Con. Limited control. While having a support system is beneficial, the process of normal delivery can sometimes be unpredictable. This lack of control can be challenging for some women, leading to increased stress and anxiety. Conclusion. Host. In conclusion, the decision to opt for a normal delivery or any other birthing method is a personal one that should be made after careful consideration. Let us summarize the pros and cons we've discussed. Normal delivery is a natural process that promotes the release of beneficial hormones and strengthens the mother-child bond. Faster recovery and shorter hospital stay are advantages of normal delivery, but physical trauma such as perineal tears may occur. Emotional support during labor can be comforting, but the lack of control in the process can cause stress and anxiety. Remember, every pregnancy is unique, and it's essential to consult with healthcare professionals to make an informed decision. We hope this video has provided you with valuable insights to help you make the best choice for yourself and your baby. Don't forget to like and subscribe. Welcome back to our channel. Today, we're diving into a topic that many of you have requested, the early signs of pregnancy. Whether you're trying to conceive or just curious, these symptoms could be indicators of an exciting journey ahead. Point 1. Missed period. One of the most common early signs is a missed period. The absence of your regular menstrual cycle could signal pregnancy. Point 2. Breast changes. Pay attention to changes in your breasts. Increased sensitivity, tenderness, and darkening of the areolas might occur. Point 3. Fatigue. Feeling unusually tired or exhausted. Pregnancy hormones can cause fatigue. Point 4. Nausea and morning sickness. Many pregnant women experience nausea, often referred to as morning sickness. It can occur at any time of day and might be triggered by certain smells or foods. Point 5. Frequent urination. Have you noticed yourself visiting the bathroom more often? Pregnancy can lead to increased urination due to hormonal changes. Point 6. Food aversions and cravings. Your taste preferences might suddenly change. Cravings for specific foods or aversions to others could be a sign. Point 7. Mood swings. Hormonal fluctuations during early pregnancy can impact your mood. Don't be surprised if you find yourself feeling emotional or irritable. Point 8. Abdominal bloating. Some women experience bloating or a feeling of fullness in the abdomen. It could be attributed to changes in hormones and digestion. Point 9. Increased basal body temperature. If you've been tracking your temperature, you might notice a sustained rise. This can indicate pregnancy, but it's important to track consistently. Point 10. Implantation. Bleeding. Spotting or light bleeding might occur when the fertilized egg attaches to the uterine lining. It's often mistaken for a light period. Conclusion. Keep in mind that these symptoms can vary widely among individuals. If you suspect you might be pregnant, it's always a good idea to take a home pregnancy test or consult with a healthcare professional for accurate guidance. Outro. Thanks for joining us today. If you found this video helpful, don't forget to hit that like button and subscribe for more informative content. Remember, every pregnancy journey is unique, so stay informed and take care of yourself. Until next time. The size of the fetus at 16 weeks pregnant. At 16 weeks, your fetus is now the size of an apple. Your little one could be more than 4.5 inches long, crown to rump, and weigh close to 4 ounces. How big is my baby at 16 weeks? Your baby weighs in at a whopping 3 to 4 ounces, and is 4 to 5 inches in length. The backbone and tiny muscles in your baby's back are gaining strength, so she can straighten out that head and neck even more. Thanks to those developing facial muscles, your baby is capable of making a few expressive frowns and squints, even at this early stage. Baby's beautiful eyes are finally working too, making small side-to-side movements and perceiving light, although the eyelids are still sealed. Delicate baby skin. Your baby's skin is thin and translucent. It will thicken and develop as your pregnancy progresses, but will continue to be almost transparent for quite some time. And here's the skinny on baby skin, it's practically translucent now, so if you took a peek inside your uterus, you'd be able to see your baby's blood vessels under that thin skin. Scalp patterning. On your baby's scalp, hair follicles are forming a pattern that will remain for life. This patterning sets the stage for how your baby's hair will grow. New hair follicles don't form after birth, so babies are born with all the hair follicles they'll ever have. Heart at work. Your baby's heart is now pumping about 25 quarts of blood each day, and this amount will continue to increase as your little one develops. Baby will soon hear your voice. Listen up, tiny bones in your fetus ears are in place, making it likely that baby will soon be able to hear your voice, or something like it, when you're speaking. Generally, babies fully develop the ability to hear in the womb by 18 weeks of pregnancy. During its 16th week of development, a fetus will be starting to form facial expressions, and its nervous system will be growing. Your body at week 16. Rapid growth. At 16 weeks pregnant, your uterus is growing at about the same pace as your baby's. It's getting to the point where you may not be able to hide your pregnancy anymore, even if you wanted to. Your 16 weeks pregnant belly. At 16 weeks pregnant, you may now be at the stage where your bump clearly has a baby in there. Your pregnancy weight gain. It may be hard to watch yourself gain weight during pregnancy, even when you know there's a wonderful reason for it, but try to embrace your body's new shape and think of every pound you put on as a sign of good health for you and your baby. Nasal congestion. 16 weeks pregnant, your symptoms. At 16 weeks pregnant, here are some of the symptoms you may be experiencing. Skin changes. You might have heard about the pregnancy glow, and now it might be your turn to experience it. Increased blood volume in the blood vessels and pregnancy hormones causing more oil production can make pregnant skin look flushed and dewy. Nosebleeds. At 16 weeks pregnant, nosebleeds can be an issue for some moms-to-be, and might be caused by increased circulation and higher levels of hormones. Lower back pain. This is one of the most common symptoms that can strike when you're pregnant, and it's good to have some strategies to avoid or lessen the discomfort. For example, take warm baths or showers, stretch regularly to help your hardworking back muscles relax, pay attention to your posture, and wear low-heeled shoes. Dizziness. Round ligament pain. As your amazing uterus grows, the round ligaments that support it are thickening and stretching. Breast changes. Pregnancy headaches.
Introduction. 1. Briefly explain what fetal development is. 2. Mention that pregnancy lasts 40 weeks and is divided into trimesters. 3. Highlight the importance of prenatal care. Baby first trimester, weeks 1-12, seedling weeks 1-4, 1 o'clock 2 o'clock. 1. Week 1-2. Pregnancy technically starts before fertilization. 1. No embryo yet. 2. Week 3. Fertilization occurs, right pointing arrow sperm meets egg, right pointing arrow forms a zygote. 3. Week 4. Implantation happens, the embryo starts developing. Anatomical heart weeks 5-8, 2 o'clock 3 o'clock. 1. Heart starts beating, week 5. 2. Major organs begin forming. 3. By week 8, it becomes a fetus. 4. Tiny arms and legs appear. Brain weeks 9-12, 3 o'clock 4 o'clock. 1. Facial features form. 2. Fingers and toes develop. 3. The brain grows rapidly. 4. The baby can move but is too small for the mother to feel. Pregnant woman second trimester, weeks 13-27, biceps weeks 13-16, 4 o'clock 5 o'clock. 1. Baby starts sucking thumb. 2. Bones harden and muscles strengthen. 3. Gender can be seen on ultrasound. Foot weeks 17-20, 5 o'clock 6 o'clock. 1. Mother feels movement, quickening. 2. Lanugo, fine hair, covers the body. 3. Skin develops, but it's still thin. Ear weeks 21-27, 6 o'clock 7 o'clock. 1. Hearing develops, baby can hear sounds. 2. Baby starts swallowing amniotic fluid. 3. Lungs begin developing, but still immature. Baby third trimester, weeks 28-40, glowing star weeks 28-32, 7 o'clock 8 o'clock. 1. Baby opens and closes eyes. 2. More fat accumulates under the skin. 3. Baby kicks and stretches frequently. Upward trend weeks 3-36, 8 o'clock 9 o'clock. 1. Baby gains weight rapidly. 2. Head moves down, in preparation for birth. 3. Lungs almost mature. Baby bottle weeks 37-40, 9 o'clock 10 o'clock. 1. Baby is full term at week 37. 2. Final weight gain before birth. 3. Baby is ready for delivery. End conclusion, 10 o'clock. 1. Summarize fetal development. 2. Encourage prenatal care. 3. End with, congratulations, your baby is ready to be born.
Hello and welcome to our video on pregnancy workout. Being pregnant can be a beautiful and special time, but it can also come with its own set of physical challenges. In this video, we'll be talking about the benefits of staying active during pregnancy, as well as the potential risks to be aware of. Whether you're a first-time mom or a seasoned pro, this video will give you the information you need to make informed choices about your pregnancy workout routine. The advantages of pregnancy workout. Regular exercise can help you maintain a healthy weight, reduce the risk of gestational diabetes, and improve your mood. It can also prepare your body for labor and delivery, and help you bounce back more quickly after giving birth. Additionally, staying active during pregnancy can have long-term benefits